Hi, this is Dr. Daria Hamrah, facial cosmetic surgeon, Washington, D.C. Today I'm going to talk to you about facial slimming. Since the Zoom boom and the pandemic, I can't tell you how many patients come to me and ask me to have their faces slimmed down. We all know why that is. We don't, there's not a day where we don't look at ourselves on some sort of screen, whether it's FaceTime or WhatsApp or Zoom. And so the more time we spend on looking at ourselves, the more things we actually start picking up, things that we hadn't noticed in the past. And of course, what did the pandemic do? We're sitting home all day and we're probably eating a lot and not moving too much, which, guys, you got to go out there, you got to move around, so your health is the most important thing. So don't look for a pill or a surgery as a solution. So this video is meant to describe facial slimming, but also to motivate you to go out there and, be healthier. Because honestly, if you live healthy, eat healthy, and walk around a lot, you really don't need me to slim your face down, okay? So you can be assured if you come and see me, I will give you the same advice before I even talk about what facial slimming is, okay? But I don't want to get off topic now. I just wanted to have a little pep talk because I have a lot of patients that come to me in the past year for this procedure, and is because they might have gained weight and now they're looking to look their best when they're on a Zoom call or on FaceTime, and they don't like their chubby cheeks, they don't like their double chin, and they don't like just the volume in general, because all of these things look even worse when we have our head turned down and looking at a screen. It just makes everything look bigger. So I also educate my patients a little bit about not to judge their selfies too much. As a matter of fact, a couple of years ago, I wrote an article in the Washington Post explaining why you shouldn't judge the way you look based on a selfie because of the distortion. And so if you haven't read that, you can just Google it. Google my name, Washington Post. You will see the article. Hopefully that gives you a lot of valuable information so you can judge your looks properly in a mirror as opposed to looking at a selfie. And also, some advice for your health in general. When you look at a screen, make sure your head is turned up, not turned down, because it really puts a lot of strain on your neck and your disc on your neck. So facial slimming, what are the things that we can actually address surgically and non-surgically? Luckily, right off the bat, all these procedures are minimally invasive, have maximum of like 3 days recovery, and you will get instant results, and they will last for as long as you don't regain the weight, okay? So a lot of people ask me, well, how long does it last? Well, I don't know. How much do you eat? How active are you? Are you planning on gaining weight? So as long as you don't gain weight, the results will last forever. So main components that make your face look bigger and round are your cheeks, the volume under your jaw, which is your neck, okay? So let's start with the cheeks. What can be done for the cheeks? Well, there is something called the buccal fat pad. Some of you call it the buccal fat. It's actually the buccal fat. That fat is a fat that doesn't go up and down with weight gain and weight loss, okay? That does not change that fat. Genetically and biologically is a type of fat that is meant for suspension and lubrication of the jaw muscles. It's actually in the deeper layer, but it bulges out in some patients genetically. That's how they're hereditary. That's how their anatomy is. And others is part of aging process, where the ligaments loosen and things kind of prop out. So the way these buccal fat pads, and we have one on each side, are removed is through inside your mouth with a tiny incision inside your cheek. The fat actually, as soon as you make the incision, it pops out, and then you just tease out as much as you need, and then you just remove it and then stitch the gums back on the cheeks, and it's like you bit your cheeks as far as your recovery. We all have accidentally bitten on our cheeks, and so there's not a lot of pain involved with it, but you can still feel a little soreness, which goes away after a couple of days. So once we remove the buccal fat pad, now our cheeks go further in, kind of get sucked in, which makes our cheekbones pop more, so it gives us more contour, which is the contour that many of my patients are looking for, a more of a heart-shaped, triangular-shaped face with less fullness here. That throws a nice shadow, which looks more attractive and makes your facial contours pop more. Okay, very natural. Now, the one thing I have to tell you is that you won't look dramatically different, you know. As a matter of fact, no one will notice. They will just see, like, subconsciously, they'll look at you and like, she looks good. Wonder what you did. Maybe it's the makeup. So it's nothing that makes you drastically look different, okay? So if you want to look at some of my before and after pictures on my Instagram or on my website, you can see how little the difference is. It's very subliminal, but it makes someone look more attractive and look like they lost some weight, actually. Good news is that fat, you can't gain it back because, again, biologically, it's not a type of fat that grows, okay? Well, a lot of patients ask me, well, won't I look like skeletonized, like sunken in, or what happens when I get older? Because my doctor, he wants to inject fat in me. That's different. That's the fat that's right under your skin, okay? This fat is much deeper, it's actually inside, and that does not affect that, okay? So a very important thing to consider. The second thing is the fat in your neck, double chin, right? So there's a lot of stuff. There is like this Cool Sculpt, there is Kybella, all of those things. Guys, they really are not worth their money. They don't work that great. Just quick reviews. Cool Sculpt just basically freezes the fat cells, and it's just good for maybe like little fat pockets or something. Same with Kybella. It's basically injecting an acid into the fat that's supposed to dissolve the fat. It's actually extremely painful, and you need to do it like 3 or 4 times. So for you to just dissolve a little bit fat pocket, and you can't do like a whole, you can't really contour it, to dissolve a little bit fat, you have to wait 6 months, and then you look at the before and after pictures, and sometimes you don't even know which one is the before and which one is the after. And it's very expensive, painful, not worth it. I don't even offer it in my practice because honestly, I don't think it's worth it, okay? So there is much better alternatives like liposuction. Now, a lot of you hear the word liposuction and say, oh my God, isn't that surgery? You know, my sister had liposuction on her belly. She was in pain for like 2 weeks and she had to rest. It's different, guys, okay? So liposuction of the neck and lipocontouring that actually removes the fat instantly, and you can actually contour the jawline with it beautifully. There is basically 24 hours recovery, and there is no pain associated with it because you actually numb everything. So you can do it fully awake in the office, or if you combine it with other procedures, you could do it under simple sedation in the office. So it's not a big deal, really. It's nothing compared with body liposuction. It's the same name, same terminology, same process, but different anatomy. So therefore, the recovery is way different. So the good thing about liposuction, which is my preferred method, is you can instantly see the result. It's absolutely painless. It costs the same as Cool Sculpting Kybella, and you don't have to wait 6 months to get the results. Forget about maybe results. You actually get guaranteed results because you're removing the fat instantly until there's nothing there. More importantly, you can actually sculpt, okay? You can literally sculpt the jawline and everything based on what's going to look attractive. So there's a lot of art associated with it. Now, once you remove the fat, if you, let's say you're in your 20s or in your early 30s, you get away with just simple liposuction. If you're, mid-30s and up, you might need a little tightening of the skin because if you remove the fat, the skin might sag a little bit. And you might not like that. So for that, I use what I explained in my previous video about non-surgical facelift and face tightening using radiofrequency energy. It's just basically heat. You have two probes that one goes under the skin, one is on top of the skin through a tiny hole behind the earlobe. You introduce it, exposes the skin to heat using radio frequency energy, and that just shrinks the skin. It's kind of like shrinking your shirt from a size medium to a size small. It just tightens everything, helps the contouring after you remove the fat. Works all the time. You can see before and afters on my website, on the link below, or on my social media handles. And what I love about this is you see the results instantly. And with time, it even will get better. So usually at 2 to 4 months, you get the maximum results. But until then, you can instantly benefit from it. So that's really the facial slimming procedure. It's probably the most common procedure that I do now, and my patients are ecstatic about the results, and I highly recommend that if you're planning on spending your money wisely, and don't waste your money on other gimmicky stuff. Thanks for listening. This is Dr. Daria Hamrah, facial cosmetic surgeon, Washington, D.C. Have a great day.